Dr. Darien is back now, taking a look at some of the questions that you are asking. Here is one from Millie. How do I know if I have pink eye or just an eye irritation?
Great question. They can look really similar, especially like allergies when you have both eyes. And so just to help everyone understand, your pink eye can be caused either by a bacteria or a virus. It usually starts in one eye and then travels to the other. That should be your first indicator if you have one eye with symptoms and the other eye is fine at the beginning. And then allergies. Those are usually both eyes, and they can be incredibly itchy, and they usually go away when you stop being exposed to the allergen or the irritation. So most of the people ask, well, how can I get rid of my pink eye? If you don't do anything, it will most often go away by itself in about a week or two. But if you have increased pain, discomfort, or changes in your vision, you should get evaluated because antibiotics or some other form of treatment might benefit you.
Is pink eye contagious?
It is extremely contagious, especially the most common type of pink eye, viral pink eye. Just being near someone, you have a chance of getting it, so you've got to be careful.
Anybody with a kid,
yes.
you know.
Exactly. Yeah.
Your prescription for wellness.
Speaking of children, how do we get our holiday safety bags and safety kits together, thinking about the things that we need, especially as we move into this viral season? I think the most important thing is a digital thermometer. You don't need a special thermometer. And as an ER doctor, those forehead thermometers are not as accurate as you want them to be. Sticking to the basics is the most helpful. Of course, you want to have things like acetaminophen or NSAIDs for pain, discomfort, or fevers. And if you notice a fever, have no fear. Just wait to see if it goes down and then consult your provider. And then also saline nasal washes and also suction bulbs. I stick to these things instead of decongestants because sticking to the basics is probably going to be the most effective. We've talked a lot about decongestants. Unfortunately, the data isn't there. And I think really important, know your child's weight and their vaccination status. The weight is for the medication provision. So when you're giving out the acetaminophen or those NSAIDs, it's weight-based. And so you want to have an up-to-date weight. Many parents come into the emergency room, I weigh the child, and then I realize that they've been underdosed, and that's the reason why their fever is persistent. So those are some key things you need. And then remember, there's still time to get your flu vaccine and your COVID update. There is the numbers are still low, and so you can still better protect yourself as we move into the holiday period.
You agree, Mom?
Yeah. Those little people are a journey.
They are. ER doctors that work with me don't get sick from our patients. We get sick from the kids. So you got to make sure to be careful.
Same.
Folks, we would love to hear from you. So please hit us up on Instagram with all of your medical questions for Dr. Darien at ABC GMA3.